Care Navigation is a multidisciplinary team of nurses, pharmacists, dietitians, and social workers, and we're truly there to help improve members' lives, meaning the health outcomes and the quality of their life. Healthcare is very confusing, it can be expensive, and when you have somebody who can hold your hand when needed or who can empower you to be able to make decisions on your own, that could be understanding how to log into the portal and where to click, to finding a provider, or maybe you're going through a life-changing experience and you don't understand the disease process or what resources you have available to you. It's really imperative to be able to know your options and know how to connect to those options at the most affordable price so that you can really live your best life. Empowering members is one of the main goals of our Care Navigation team. We don't want to just help somebody with their need of the moment, but we want to be able to educate them and help them to help themselves in the future. We started out with social workers, and we recognize that social workers are very important to have. Most traditional care management programs are nurses. But when you look at the health outcomes and quality of life, only 20% is clinical care. The other 80% is health behaviors, social and economic status, physical environment. So when we think about that model of 20% as clinical care and 80% as social determinants of health, that's why we decided to start with social workers. However, social workers do have an expertise to help with psychosocial situations and emotional and behavior realms for members. What we recognized is that there is a need for a pharmacist, there's a need for nurses, there's a need for dietitians because of the wide range of needs that a member has. So we started to add those different disciplines, and now we have this multidisciplinary team, and they can consult among one another and be able to view each member through their different expert lenses so they can truly be a team and help the member where they need. And so that's one of the main reasons that we've grown, is to add those different disciplines. Additionally, we've grown our team because we recognize the impact that we had. And as we view data and we look at the metrics, we see how impactful Care Navigation is. And so as we grow that team, we're able to pilot new programs, we're able to analyze a population and do specific interventions to be able to impact that population. The difference between care navigation and care management for me is that a traditional care management program has pre-existing conditions that you have to qualify for. For example, you have to have hypertension and diabetes, or you have to have a behavioral health diagnosis along with a chronic condition diagnosis. Care navigation, as being condition agnostic, you could just reach out to our team and say, I'm having a really crappy day. I didn't go to work today because I could barely get out of bed. And we have the right tools and the right resources and experts on our team to assess the member and find out, why is that? Is your diabetes out of control because you don't feel like eating? Okay, well, let's go ahead and connect you with a therapist. Here are some of our program partners where therapy is part of your plan design and it's a benefit that's provided to you. NCQA NCQA stands for National Committee for Quality Assurance. So NCQA is a not-for-profit private company who is able to go through a rigorous process of reviewing policies, procedures, documentation, and interviews to make sure that we're not only saying that we do great things, but we actually do great things. And when I say great things, I mean provide quality care that's backed up by evidence. So Collective Health is one of the first TPAs, the only one that I'm aware of, but there may be others out there that I'm not aware of, who is NCQA certified for complex care management. And that's so important for us, and we were able to celebrate it because it really shows that we're giving quality care based on evidence. My name is Kelly, and I am the Senior Manager of the Care Navigation team. I'm a registered nurse by background.